Regarding the elbow stiffness, the functional range of motion is 30 to 130 degree of flexion to extension, and the supination and pronation is 50-50. You need to check the range of motion and check if this firm or soft endpoint to indicate a bony block. Regarding pathoanatomy, it can be intrinsic or extrinsic. Extrinsic can be atrophic ossification, any ligament, capsule, or other soft tissue structures, contractures. Like on the intrinsic would be fracture, arthritis, osteochondrous dissecans. These can be possible with rheumatoid arthritis, osteoarthritis, or post-traumatic. Treatment can be static progressive splinting, physiotherapy, plus steroid injections. Open debridement and soft tissue releases to improve the range of motion. Arthroscopic debridement consists of capsular release, removal of osteophyte and loose bodies. Ulnohumeral distraction interposition arthroplasty in young individual with high demand. We interpose Achilles allograft or synthetic grafts. Olin-Kahn fossa debridement for the loss of extension. You can do Outbridge Kawasaki OK procedure, posterior approach. You can do lateral column procedures, such as for loss of flexion, you can do lateral column lengthening. You can do also medial open approach. Synovectomy can be considered for rheumatoid arthritis. Other transposition is sometimes needed.